Child I worked about.
And he says he,
Yeah, tomorrow night he's up.
Just letting everyone know that Chambers is now unmuted.
I don't know.
And we are live on YouTube.
I love it. So close.
Everyone's ready? Okay, let's call the meeting come to order, please. Minutes to approve. We do have a quorum. Minutes.
So move.
Second.
Any questions on the minutes? If not, all those in favor, aye.
Aye.
Opposed? Carried. Presentations, Linda or Natalie, are you on?
I'm right here.
Sitting over there
Oh,
behind you.
you're over there, okay.
We get the charm of.
Don't sit right up front.
Oh, sit right up front. So I'm just gonna give a quick little budget review. I had sent you an email maybe a week or so ago, week and a half ago. So I did have a spreadsheet I had sent you there. And you know, I kind of just reviewed things at the halfway point in the year. And probably the biggest account to look at is the sales tax. And if the second half of the year 22 performs like the second half of the year of 21, we should be about 1.3 million over budget. Last year we were $6 million over budget, so it's not nearly as significant. Obviously, if there's a downturn in the economy between now and then, it won't be as much. And we could also have a surprise the other way. We also will have some impact from taking away the home heating fuel tax. I'm not exactly sure. There's a lag, obviously, in payments from when the state collects them and when they remit them to us. So I'm not sure if there's going to be a lag in that. It's not going to be like October 1st, immediately when they stop it, that our payments will go down. So there might be a little bit of a lag. I wouldn't say it's going to be a quarter effect probably in this year. So, sales tax is still doing strong, and it's up 4.5% over 21. So we are still doing good there. The MHL revenue is definitely projected to be down. I projected it to be under budgeted about 600,000 instead of 1.4 million, maybe closer to 800,000. But the sheriff just told me in a meeting we were at before this, they have gotten some more federal inmates. Another county was not able to take them, so he's been able to take some of those. So that might turn out a little bit better. That will at least maybe hit the million, maybe $1.1 million with that. So that was some good news. The expenditures, overall, most budgets are pretty on track. I just kind of looked at them to see the percentage of spending. I'm probably very conservative when I look at that. When I get into detail of preparing the budget, and I'll go through every account, the salaries and fringes in detail, we have quite a few vacancies. We'll probably have quite a bit of savings there. Everybody was kind of under, in the 40% range, where we were halfway through the year. They should have been at 50. Pretty much everyone is well below that. I was looking really more for overages, and spending concerns that we would have. One of the areas is in gas, gasoline. The highway department actually is going to be bringing a resolution this month to do some budget adjustments. They're significantly over. I think they're spending twice as much money as they budgeted. We're over budget by like $300,000. So for this year, it's pretty much coming out of the D fund balance to cover that. So you'll see that in the resolution that we had. Besides that, we have a couple of offsetting swings in the Department of Social Services. One of their foster care accounts is going to be over maybe by about 600,000, but it's offset in another foster care account that will be under budget. Their safety net account is also running over budget, could be by about $500,000. There is some reimbursement for that program. But again, there could be under budget in this one foster care account by $1 million. So I think overall, they're going to be okay overall, their whole department. That's something we'll have to see. They have had mandated increases in foster care rates that they will be budgeting for, which they sound significant on the surface, but actually placing one kid in an institution is much more significant in expenditure for the year. So we have had a better year with that this year. That's why we're going to be under budget in social services. So I don't know if you have any specific questions. Like I said, I just kind of did a general overview to look for any things that could be alarming that we have to kind of address right now. There really is not. So we'll get into much more detail this that when we prepare the budget for 23, I spent a lot of time working on the projections for 22 at the same time, so I can get a more accurate either I don't think there'd be any use of the fund balance, but what we might be returning to the fund balance. So as we get a couple more months of activity in there too, we'll have August and September in there before we do it.
You have a question, Hans? The foster care is still reimbursed through a foster care block grant?
Majority of it, I mean, there is open-ended funding for E. It's still available for room and board for those children that qualify for the eligibility.
And the block grant seems to be meeting the needs, or, I mean, I know it's, you have a high year and then low year and then.
I mean, there's significant local costs to foster care. So what happens a lot of times is that block grant you're referring to, we did have a really bad year last year in expenditures. So when the state looks at that to allocate the funding, a lot of times our next year will be up slightly, but it certainly doesn't cover the cost of foster care. It's a local.
That's why the expensive cases need to be attempted to be. Yeah.
Right. Which they are doing certainly. So they've been focusing on that. I think they had some children, obviously during COVID, kind of got stuck in foster care for some periods of time too, because there weren't a lot of transition that you were able to do. So I think they've been able to do a lot, to get those kids moving.
Any other questions?
Yeah, Hans, I got one for Lynn.
Go ahead.
Yeah, Lynn, can you explain what was it the state did or adjusted or whatever that lowered our sales tax compared to what we thought we were going to be?
Yes, they do some quarterly adjustments, I believe, in June, and there's another one in December. And I guess, it's kind of almost like my NICEAG, budget or not budget, the actuals, when they're estimating the months, even though they're collecting sales tax from everybody paying it, they distribute it to the counties based on historical information in the prior year. And so it all got kind of really messed up with COVID. And so they were actually giving too much of the sales tax to upstate counties. And when the actual adjustment came in June, a lot more of it was supposed to go to New York City. So we really kind of got overpaid in April and May. So when you're just going month by month, you're like, oh, this looks wonderful and great. And then the adjustment came in June, and it overcorrected and took money away. We had the opposite thing happen in 21. We didn't think we were doing that great, and then we got a huge adjustment that gave us way more money. So I think that the sales it's way up again in New York City. They're doing a lot better. So
Based on actuals.
yes, it's the actuals, right? So for whatever reason, however they do their allocation, there is this estimating that happens for several months, and then they true it up. And when they did that, there was a negative impact to majority of upstate counties. It certainly wasn't just us.
Any other questions, comments?
Just one more. The increased federal payments through Medicaid, I know you don't totally budget them every year because you're not certain they're going to continue. Do you have a sense of that? I mean, for the last so many years, they have given us more federal reimbursement.
Yeah, they right. So it was increased federal reimbursement, which really reduced our weekly share. Because of COVID, at first, there was a little bit of that extra coming. Then we thought it was only going to last until March of 22 when I did the budget. It ends up that it's through the end of the year. I honestly have not looked at it yet to see when I budget it, how long it's estimated to last. I don't think it's going to continue on much longer. I would not think, because I think they're kind of going to be stopping that, but that gave us some savings. Definitely. Okay, the other thing I wanted to talk to you about, Fred is probably going to help me out a little bit with this, is a law that the governor passed as part of the budget at the state. It includes a healthcare, it's called New York State Healthcare Mental Hygiene Worker Bonus Program. And we knew it was in the budget, but we finally got like some directive actually published by the state that they've sent out to all healthcare providers. This is not just for municipalities, this is for anybody in New York State. And if you are an eligible employer, which we are, and they go through a lot of criteria that makes you an eligible employer. One of it is how you're licensed, which their mental health and our public health are certainly licensed under these certain articles of state law. So we definitely qualify as an eligible employer, and we do bill Medicaid. So we are going to have to comply with providing these bonuses to certain qualifying employees. The regulations are very strict and stringent. They have titles of people who are entitled to this. Majority of them are all of a type of a healthcare worker, meaning a nurse, caseworker, a licensed social worker, therapist, which we don't employ any of them, but if we did, we would have to pay them. So it's very prescribed, I guess is what I want you to tell you. And comply with this, there are penalties for not doing it. So we do have to comply with this. So I've kind of been working on it a little bit, and I'm working on it with the departments and Fred and Rich have been looking into it, reading the legislation, reading the laws to see. Some people obviously qualify. Oh, that's my phone, sorry. And it's pretty clear, some of them, other ones are a little bit grayer. And that's kind of where we're working together to try and figure out, who qualifies.
When I hear caseworker, you're not talking about the Department of Social Services caseworker, are you?
I don't think so, no.
You're talking
Case
about a
manager.
case manager
Right.
in either mental health, public health, or.
Right, I mean, one of the sentences in here is saying such workers must support patient-facing care provided within a patient care unit of a hospital or other institutional medical setting in support of treating and caring for patients. So this is very directed at
Hands-on.
hands-on medical care. And obviously the mental health workers, though, that's where it goes into more about a case manager, intensive case manager, licensed social worker, aide, as long as they're working directly with the clients. So, we're working on building the spreadsheet. I guess, I'm only giving you information at this point. There's no resolution in front of you to pass yet. We're anticipating that will be coming next month. We have a very prescribed, we only had 30 days from when these regulations came out to actually submit a claim, which is basically like the beginning of September. And then we have, after they pay us, so we're going to claim it first, state's going to pay us. It's up to $3,000 per employee. They have 6-month vesting time periods. They have to work a certain number of hours on average per week to qualify. So again, very prescribed. We're getting that information from the payroll department so we can see, who qualifies and who doesn't. After we submit it, we'll get payment. And then again, we have only 30 days to pay it to employees. So in September, like we said, we would be asking for authorization to, be able to pay this, to be able to maybe if we have to amend any contractual agreements. Obviously, some of these people are union members. There's a lot of questions. There's a webinar on Friday that I can't even watch it, but I did just get an email from Kathleen that Nice Show was going to be recording it, that will be shared with people afterwards to watch it. There's a lot of questions, I think, as an employer about payroll taxes. Does this qualify for retirement contributions? And we are required in this law that if I claim $1,500 from Hans for him, I have to give him the $1,500. So that means if there's payroll taxes due, it's going to be on the county. You're not going to be able to get reimbursed for it. So there's a lot of questions I think that are unanswered. So you can ask them. We might have answers, we might not, because I think we're all still trying to gather this, and the state is not. It's coming from the State Department of Health, so they're not really answering these questions about payroll issues and things, because it's certainly not their area of expertise, and it's very hard to get anybody to answer the questions for us. So
Do you think this is Medicaid money that?
I do think it's Medicaid money, because when we're claiming with a Medicaid number, we're going to be getting paid with it. I do think though some of it's not Medicaid money because there's a separate way to claim it. But I think the state's trying to maximize any Medicaid funds that they can. But that could be why it's so prescribed. They don't really say.
Anybody else?
Yes,
Okay.
so this is, you said it's prescribed and there's criteria and so forth. So wouldn't that apply with the amount of money they're gonna get, which could include payroll tax and everything else when we set? Or are they just some amounts? Is there a sheet?
There's no, you'll claim the amount per employee. It's either 500, 1,000 or 1,500 for 6 months, depending on how many hours on average they worked. Most of our people will get the 1,500. And that must be paid to the employee. So if this all qualifies as regular wages, you'll still have to owe the taxes and we'll be on the hook for that. If that's, and retirement contribution is another question. So we'll have to pay that also, which we pay on everyone's wages.
So that's a question for the state then, when you get a chance to talk to them and say, wait a second.
Yeah, we've asked it. There's been no answer. So we've asked the questions. I'm just saying to you that everyone's asking these questions across the whole state. So we certainly are going to continue to, try and get them answered and see what we can do.
And we may be coming with a resolution that doesn't have all the answers to the questions. We'll have to anticipate, but you'll see the resolution next month. Because as Lynn indicated, the data has to be provided by September 2nd. Payment comes after that, and then 30 days after the payment comes, we have to prepare to act. So we may have 45 days from now to do something. So we'll keep the committees apprised, and as soon as we get the resolution or more information, we'll bring it to you.
Heidi?
Lynn, does this appear to be right now, it's a 1 year?
No, actually, it's really a retention and recruiting bonus. So actually, it's good until sometime in 24. So as new employees come on, as they serve their 6-month time period, they will qualify. So there may be more than one resolution coming. We're not certain how we're going to rate it or anything, but this will impact new hires also. I mean, I actually have a couple. So the first time period was from October 1 of 21 through March of 22. So people who've been employed clearly qualify, and a lot of people qualify for the second one, but we have had new hires who aren't qualifying for the first one, who I'm sure are going to qualify for the second. So it is a way to kind of recruit mental health workers or nurses to keep going to these certain employers who are participating in this.
Anybody else?
We can't take it anymore.
Thank you.
Unfunded mandate.
Yeah.
Partially.
Mr. Dempsey? President's report.
Are there any questions?
Any questions for David? Anybody? If not, thank you. Mary Beth Leeson isn't here tonight. Diane? There she is.
Hi, good evening. I'll just ask if anybody has any questions tonight.
This is good.
All right, thank you.
Thank you.
You want Jen to go, Hans?
Did I go?
Just
Yeah,
give
you
me-
skipped.
Oh, I did. I'm sorry. Jennifer, please.
So you have my report in front of you. I do have a couple of items to add. I have checked with the city treasurer's office regarding whether or not they're going to have an auction this year. They said that they still do plan on having an online auction. Bob Gothier is supposed to give me a call sometime next week that hopefully he'll have more plans finalized. He's just kind of waiting on their corporation council to move forward with their auction. So that one parcel that didn't close from our auction, hopefully we'll be able to put that in theirs this year.
Nice, thank you.
And I do have a state legislative update as well. So the state has passed a law to increase the allowable income limits for senior exemptions and exemptions for persons with disabilities. So this is a local option. You essentially what it does is it increases the maximum income limit, which is currently 29,000 up to 50,000. And that would give them a 50% exemption at that amount. Right now we're on a sliding scale. So people will earn, if they earn up to $37,399.99 right now, they can get a 5% exemption. This new legislation brings that wage up to $58,399.99. So I'm not sure if this is something that the legislature would like to consider doing, if it would like me to move forward with any of this, or if you'd like to discuss it with me at some point.
This is a property tax exemption.
This is a property tax
And didn't
exemption.
we just do something a year or more ago, because we hadn't looked at this in like 1,000
So-
years?
Back in February of 2020, there
Yep.
was a local law that went through that did increase the amounts, and it updated the sliding scale.
And that hadn't been done in
It looked like it had not been done in I think since 2007 was the prior local law to that.
And this
So-
is supposed to help lower income people pay their property tax.
Right,
Or
senior citizens
seniors.
and
Sorry, yeah.
Persons with disabilities that are low income as well.
Okay, seniors and developmentally disabled individuals
Correct,
meet an income threshold. Okay,
correct. But like I said, the state has increased that salary threshold. The legislature doesn't have to act on it. Like I said, it's a local option, so it is something that could be acted on if you want.
Does it apply to school taxes also?
It would be up to the school districts and also the local municipalities to pass it for their municipalities. So
Any questions, anybody?
it has, just a very quick, I don't know what you mean by Article 7 assessments in small claims cases have been filed. You have small claims cases against?
so if there are assessment challenges, it can take two routes. It can either be an Article 7 assessment
Okay.
challenge, or it can go through small claims.
Cool.
If it's like a residential property, it'll probably go through small claims.
Like a small claims court?
Yes.
Okay.
It's specific to assessments.
Okay, any further questions?
It is through the court system,
It
yes.
is the court system. It's
Yes.
not an arbitrator that sits down with the
No, it
assessor
is,
and,
it's through the court system,
okay.
yes.
Do you happen to know how many of these we have?
I will have to double check for you. Off the top of my head, I believe that there are 4 or 5 small claims. And I could provide
So
Five
it's,
small
Five
claims. 5.
of the other ones.
so it's not a lot.
It's not a
No,
lot.
it's not a lot.
Thank you.
Anything further? Any questions, comments? Not, thank you.
Thank you.
I guess unless I missed something else, down to resolutions. Resolutions, so, Ways and Means has 2 resolutions. We've been through them. And I move both of them. as a bundle.
Second.
Any second?
Second,
Any discussion on WM 1 and 2? If not, all those in favor, aye.
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 Anybody opposed? No? Carried, thank you. Health and Human Services.
Health and Human Services had 9 resolutions, and all of them have gone and passed through committee. None, in my opinion, are controversial. So unless anyone wants one or more broken out, I would make a motion to bundle HH1 through HH9.
Is there a second?
second,
And seconded, so by discussion, please.
I got one question, Hans.
Go ahead.
Yeah, I'm just curious on the whole Northwoods thing. Is it working out to be as good as we hoped it would for what it costs?
My sense is that if Christine Bianco was here, she would tell you that she believes it is. Oh, Christine, yes, I mean, it has helped them to be more efficient in the field. It certainly helped during COVID, and it still is an efficiency for your casework staff. Is
Absolutely.
that-
I think everybody's glad we have it. I think, we liked it at the beginning, and I think as people have become more proficient in using it, I think we see even more benefits with, getting their notes in quicker and being able to meet our deadlines, have things at our fingertips that we need, meeting with families, all of those things that I talked about. That was our hope. I think that has definitely happened.
Any questions? If not, we'll proceed to vote. All those in favor, aye.
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 Those opposed? Carried again. Government operations. I guess government operations still, so. J1 through 8 was 5, 6, and 7 pulled. Nothing was done on them, I suppose. Elaine, anything done was, which one was yours?
Oh, the 2 of them that were supposed to be available to the Health and Human Services Committee were the HIPAA policies and the breach notification, but they didn't even come to HHS. They came first to government ops, and I think the plan was government ops pulled them, and next month they'll go through government ops and be available to the committee members of Health and Human Services. So I think it's all going to be next month.
Okay,
And the
breach
other-
notification, who was that?
Which was?
First one.
Breach notification and HIPAA were both the ones that apply to the departments that report to Health and Human Services. But there's a conversation that all policies should go through government ops. And then the other one, amending the policy for sale and distribution of real property, I think government ops took action at their committee. Is that the case? Right. Pull it.
So they're still full.
Yes.
So we've got 1 through 4 and 7 and 8. Excuse me, 1 through 4 and 8.
I'll move it.
I'd like to,
I guess moved and seconded.
I'd like to separate one,
You'd like to separate what?
GO1.
01, okay, we'll separate 01, 2, 3, 4 and 8. All those in favor? Oh, we had a second, right?
Yes.
Yes, you did, yeah. Okay, all those in favor, aye.
Aye.
Anybody opposed? Nobody opposed, so carried. Number 1, Jim?
Yeah, so this document, I didn't get a chance to read through the whole thing, but I had a couple questions. One, do we also go over their budget? They're asking us to approve this bargaining agreement. I don't know if there's anybody in this room that said.
Good evening. Hi, I'm Kelly. I'm the CFO from the college, so I am here to answer any questions. This was budgeted. We anticipated. We were very excited to have a 2.75 and then a 2% for the next 2 years. We did budget this, which the budget was approved as well through.
Point of order, Mr. Chairman, I'll move it for discussion since we haven't done that yet.
Second.
Okay, it's open for discussion.
So I guess, yeah, I'd be more interested to know how the money that we give to the college through the county is spent. And does it go into this? Was it used for this?
It's a part of the operations. We include it in our total revenues, which is a part of the total operating budget. So it is not broken out, or it is not earmarked for one particular area. It is for the entire in the operating budget.
So we don't, when we approve to give, what did we get, 3.5 million or something to the, yes, to college, we don't know how it's spent. We don't ever get a report on that.
Well, it is not earmarked for one particular area. It is towards salaries. It is towards all operations of the college.
I understood that part. Thank you. I was
Sorry.
trying to, so is it, no, it's all right. So we don't know what percentages go where then. I'm just curious how much was used on salaries and the.
I'm sure they'll give you a breakdown.
We can give, I can work on a breakdown for you. Sure.
Maybe we would ask for that from the department head or something. We would want to know the breakdown if we gave them, they're getting money out of the county budget. How does that money get broken down?
Yes, I can get that information for you.
Yeah, and I'm going to vote no on this only because I didn't get a chance to read the whole document. I've had computer issues and it was put in the, what is it, the box or the drop box. So.
Okay, any further questions or comments? We'll show our hands on this one. Those in favor, aye. 1.
Aye. You can't see my hand.
5. Those opposed? 2 opposed? Oh, yeah, okay.
Who are the 2 opposed?
Lydia, you're not on.
You're not on
Wait,
committee.
so.
Oh,
Video,
sorry.
Jim.
It's all right.
I'm not here.
Save it for next week.
Been there, done that.
I forgot where I was.
Jim Basile.
Thank you.
Okay.
Hopefully we'll get a chance to read it.
So just
between now and
one, not 2.
Public Works,
Was it planning?
Yeah, do planning up there.
There you go.
I'll send it to you.
Plan. I can do
Planning.
planning next if you'd like.
Well,
Okay, planning has two resolutions, both have been through committee and passed there, and I offer those as a bundle.
Any questions or
I'll make a motion.
second, please?
Second it, Mark.
Okay, any further discussion on 1 through 5 Public Works?
No, planning.
Planning 1 and 2.
What?
Planning.
Planning. Planning.
Oh, 6, okay.
No.
1 and
Planning.
2 for planning.
Planning.
It's all right.
Let me put my glasses on.
Yeah.
Okay. Public Works, okay.
We can-
Oh, planning.
Planning, too, yeah. I just joined you, huh? I just got these too.
Okay.
I know you are.
Okay, planning, 1 and 2. There was a second, so discussion. I guess hearing none, those in favor, aye.
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 Those opposed? Nobody, so carried. Public Works, who is in charge of Public Works?
Andy.
That would be me.
There he is. Okay.
Yeah.
Andy, go to it.
Public Works had 6 resolutions. They were all passed in committee, so I'll offer them as a bundle unless somebody wants one separated.
I'll second it. Mark.
Discussion on the bundle. If there's none, all those in favor, aye.
Aye.
Anybody opposed? Nobody, carried. Traditional and public safety, Mark.
Thank you, Mr. Chairman. JPS has 5 resolutions tonight. JP3 was referred to Ways and Means.
And Ways and Means pulled it, so.
Okay, so with that one being pulled, I would offer JP 1, 2, 4, and 5 as a bundle unless somebody would like one separated. All passed at JPS committee.
I'll make a motion for that bundle.
Second.
Okay, it's been moved and seconded. Discussion. There's none. All those in favor, aye.
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 Opposed? Nobody opposed? Carried. Thank you, Andy. Okay, guess not having any further business here. I move that we go into executive session for collective negotiations pursuant to Article 14 of the Civil Service Law. Need a second?
Second.
Okay. It's room 1, I take it.
Yes.
Hans, we will need Lynn, Diane, Sheriff. and-
Keeping me
Good,
honest,
good.
Elaine.
Oh, no problem. I knew.
Colin will join us.
Yeah, Colin's on the.
Colin, you'll want to use the executive session Zoom link.
I'll join the other one. Yes, thank you.
All right, thanks.
Good job. Verbal job. What the heck, what a job.
But we gotta come out of executive session in here. Some have already left, but
We just need to make sure. we
That's all right.
quorum for today's meeting.
yep. Don, do you want to make the motion? I'll second it.
We don't have a quorum, do we? You can't. You're not on the committee.
Oh, that's right. Yeah, didn't I? Hello. I pulled a Bobby.
Would you?
I'm not on the committee. I can't second it.
Hey, Jen.
How you doing?
You in there? Bobby? You in there?
Video, is it?
I didn't even see it.
I was behind you.
Oh, so quiet.
Oh, I do have it.
Behind you.
Oh, shoot. Oh, thanks.
I did.
You still can't.
And you want to do it?
Nope, we got a quorum, so. Okay, motion to adjourn,
I'll make a motion.
second.
Second.
All those in favor, aye? Aye. Nobody opposed.
Hey.
Thank you. Have a good night.
I gotta be out there at 9, but I'll be here like 8 or